Hi everyone. It's our absolute privilege to introduce today's speaker, Dr. Sneha Devarakonda, a name that is now etched in the Indian orthodontic history. Dr. Sneha ma'am has achieved a remarkable milestone by becoming the first Indian postgraduate to clear the membership in orthodontics examination from Royal College of Surgeons of Edinburgh while still pursuing her post graduation, which involves immense dedication, clarity of vision, and academic excellence. So today she joins us to share her MOrth preparation playbook from managing PG life to clinical work to acing both A and Part B of one of the most prestigious exams in orthodontics. So let's give a warm welcome to Dr. Sneha ma'am as she takes us beyond the books and into her real life MOrth experience. Congratulations, Dr. Sneha ma'am.
Thank you. Thank you so much, Dr. Anisha, for that introduction. I'd like to thank, before I start, I'd like to thank Dr. Anisha and your group of Dent Awesome and all the postgraduates and the students working here for making this such a student-friendly environment and, for making it so easy for all of us to learn from one another. Thank you for this opportunity. I am still a student, so whatever little I can share with you, whatever I can be of help, I will do that, and we can learn from each other.
Yeah. Ma'am, it's an incredible achievement to be the first Indian postgraduate to clear the MOrth Edinburgh exam. So let's start from the beginning, ma'am. Could you briefly walk us through your journey, right from your undergraduate days to this milestone?
Okay, so I didn't initially have a plan. I joined BDS in SRM Katanglathur, Chennai, and I got through my 5 years. I was a good student with the books, but otherwise, I didn't really have high hopes or plans for anything. I didn't even know if I wanted to take ortho. And then I took some time, and after I finished my internship, I was like, no, this is what I want to do. If it's not ortho, it's nothing else. And that's how I got into ortho. And when I was looking around at all the colleges that are, good and where I can check for orthodontics, I came across my Savitri Rental University, and there I also noticed that it was one of the centers for the MOrth exam in India. This is the only center in India. So I thought, okay, maybe one day if I join, it was just like a 1 second of a fleeting dream that day. I was like, maybe one day I'll also give MOrth. That's all. I didn't give much thought to it, and I joined. And I should say, my staff and my teachers, my mentors, everybody here has been so supportive at every step. When I finished my second year, my HOD said, well, why don't you write exam? And I said, sir, am I allowed to write the exam? And he said, why are you assuming you're not allowed to write? Does it say anywhere in the rule that a student is not allowed to write? If it says that, then stop yourself. But otherwise, why are you putting that limitation on yourself? And that's when I was like, oh, okay. And then I checked the website and I was like, I am allowed. And that's how this whole thing started. It wasn't a plan, but yeah, that's how it started.
So, ma'am, could you walk us through the Part A and Part B preparation process and what topics or formats should students focus on, ma'am?
Okay, so very simply put, part A is a written exam that gets over in one day. Part B is a clinical based Viva exam that happens over a course of 4 days. The Part A exam has two papers, 90 questions each, and they're all MCQ based questions. They're separated by a gap of 1 hour. And you have to give the single best answer for this Part A exam. Part B is divided into three: the diagnostics, the mechanics, and the communication section. I will be explaining through my presentation the elaborate structure of both the exams for you. Walk over through the exam pattern and what you need to know before you start preparing for the exam as a postgraduate. So, when I say the Royal College, it refers to a group of institutes that are set up to train, monitor the work of surgeons, and basically they set up the examinations to evaluate your standard of training. There are four major Royal Colleges. The first one, the Royal College of Surgeons of Edinburgh, is the oldest Royal College, and that's the one that I wrote the exam for. The others are Royal College of Surgeons of Glasgow, Ireland, and England. So, when it comes to the pattern for the Edinburgh Royal College, there are two exams: Part A, that is an MCQ based written exam, and Part B, that is a Viva based clinical examination. What do you have to expect when you attempt the Part A exam? There are two papers, like I said, 90 questions in each paper, and they're separated by 1 hour. So, you get 5 options in each question: A, B, C, D, and E. There's no negative marking, but you have to pick the single best answer. Now, none of these questions are going to be straight out of the textbook, none of them are going to be factual. You will have to read through it, you'll have to understand how it clinically applies. They'll give you clinical scenarios, and through that, you'll have to apply it in the given time and pick the single best option. Yes, so they'll give you an OMR sheet where you shade the correct answer, and they can even give you picture based questions. They can show you clinical photos, they can show you different types of aligner attachments, they can provide hazard or safety signs, histopathology slides, and they'll ask you to interpret that. Now, this is a sample question that could come in the Part A exam. This is on the website as well. When you look through this question, it says a 10-year-old boy attends for assessment. And if you're just reading it at a glance, all the 5 options here would appear correct. None of them are actually wrong answers. But the catch here is that the patient is 10 years old. So, according to the British guidelines, when you catch that, the 10-year-old boy, that is your clue here. According to the British guidelines for age 10, the correct answer would be D. So, there's a lot to do with how you apply, how you read their guidelines, and how you use that to answer the questions. You may know the subject, and according to that, all 5 of them are correct. But you'll have to learn to apply their guidelines, and that's how you know you got the correct answer. So, what are the topics that you must read for Part A? These are the most repeated topics. A lot of questions come from these. Not to say that these are the only topics they will ask. There will be a lot of new topics and new questions asked. But if you read this, you can be sure that you are confident to attempt it. You don't have to feel worried about your preparation. Questions like indices, the IoT and IOFTN index, they can give you a clinical scenario with all the features. And if you know the index, it's only going to take you 2 seconds to look through the question and answer the correct option. If you don't, you're going to be thinking for at least 5 minutes here. So the textbooks that you should be reading, there are a lot of books, but the main books, I would say, are Handbook of Orthodontics by Martin Coburn, Postgraduate Notes by Bristol, the 9th edition, Introduction to Orthodontics by Laura Michel, and the Picture Atlas by Jonathan Sandy. So personally, what I did was, when there are so many books to attempt, you pick one book. What I did was I picked Martin Coburn Handbook of Orthodontics. You finish the book from cover to cover, get thorough with one book, so you know that you're confident with one book. And then once you go on to the next few books, it'll just be like a revision. You'll just have to add up whatever points are left over from there. That is the attempt that I picked. It was the easiest way to approach this preparation. So what do you have to do? Understand the concepts. Make sure you do not memorize any facts, because nobody is checking you for how well you memorize anything. Make your own notes for all the topics. Take enough time to read all the photographs, all the legends that are there below each photograph or each graph. And what worked best for me, actually, I'd say find a study partner who helps you revise and cross check. So one of my seniors, Dr. Harsha, she helped me with making my own, had our own study schedule. I'm not saying study together, but you can study on your own time, and maybe keep some time at the end of the week where you can, discuss with each other and just check if you've gotten all your points or if left out anything. That really helps with your confidence level when you know someone else is also, helping you out. So you should definitely find a study partner. I say that makes all the difference here. So the guidelines that are important, all of these guidelines are available on the official website of the British Orthodontic Society. The BOS guidelines, the drug prescription guidelines, the Scottish Medical Emergency Management, immunization, sterilization, the Sedentex guidelines for radiography, and their waste management protocols. So all of these guidelines are mostly asked very, very, they're very easy to score marks on. If you know the guidelines, you don't have to be thinking about what is the correct answer. I do have a drive link where I've compiled whatever guidelines I have, and I will be sharing it with all of you. So this is what you should definitely study. Do not skip these. Now, this is what the guidelines will look like on the website, and this is just a sample. And from the website, you can get all the other guidelines, the most recent updated versions. Also, keep checking for any updates in the instructions that they want to give to the students, and you will know what you're up for. So to summarize, make your own notes and revise from your notes. Make sure you have one book that you're referring to as your standard, revise through that, and just use the other books to add on to the information. Cover all the topics. Do not skip the pictures and the legends below the pictures. And I think you'll be set for party with all of this. Additional study material, once you are done with all of the initial set of books that I recommended, I think if you have time, you can always go through all of this. Now, the study groups on Telegram, I should tell you, proceed with caution. They are very good groups. Some of them are free and some of them are paid. But the thing is, you can refer to them for the questions. Whether they provide the correct answers, you should use your own judgment. So it's just postgraduates or other students giving you their correct answer. I think you should go back, check the text to make sure that's the correct answer before you take their word for it. So that is just a word of caution I'll give you with Telegram groups. So next, the Part B exam. What do to prepare for Part B exam? It happens over a course of 4 days, and there are 3 sections in the exam. First 4 cases will be diagnostics and treatment planning. The second set of cases will be biomechanics, and the third set of cases will all be based on communication scenarios. So when you have a diagnostics case and a mechanics case, I would say the best way to prepare for it is to practice. Use pre-treatment case records from either your own cases or from your friends or seniors, or take mid-treatment records from your parallels. Use that. Think of it as a new case that's been given to you. Sit with it for 15 minutes, go through the records, and then try to make up your own plan. And you can always approach your seniors or your staff and ask, is this right? Is this okay? So I'd say the best way to get confident with your treatment planning is to practice. So for the diagnostics and even for the mechanics section, the protocol is simple. You will be given a set of case records, the most relevant records. You might not always be given the cephalometric values. So they give you photos, intraoral and extraoral, model photos, any radiographs if relevant, and 15 minutes you get to look through the records. They'll also give you a piece of paper where you can make some notes and write down your problems, your treatment aims, objectives, and what you want to do, and your diagnosis. And the next set of 15 minutes, you'll enter another room where the examiner is sitting, and you'll have to talk them through whatever you wrote down in the first 15 minutes. Now, your notes are entirely your own. Nobody's going to look at your notes or the rough paper that was given in your hand. So feel free to write down even the most basic details on that. Don't feel overconfident or don't feel underconfident to write down anything. I will say whatever comes into your head, please make a note of it, because when you're in front of the examiner answering, like, you might get anxious or nervous and you might forget even the smallest of details. So having it written down on paper always helps. You will be expected to give them a diagnostic summary. You will also have to give them an IOTN score for this case that you're giving. You will have to give them a problem list, what you want to treat, and what is your final treatment plan up to the retention protocol. Now, what they're looking for here is nothing elaborate, and they don't want to see your heroic mechanics in any of these cases. If it's a Bimax crowding case and you are saying, I will extract all 4 first premolars, you say, this is the problem, this is the aim, and finally you have to say, I want to finish in a class 1 molar and canine relation bilaterally. You cannot say, I will extract all 4 and finish in a class 1 on one side and a class 2 on the other side. Like, these are the basics that they want to make sure you're correlating along your entire narration of the case. So again, this is a sample of the case records available on their website. And if you look at the records here, they don't give you all the cephalometric values. They only give you the values they feel is most relevant to make the diagnosis for this case. And the last 3 factors that they give on the patient details, that is the periodontal status, the dental status, and other information. To them, this is very, very important. So the periodontal status, when they say satisfactory, is fine, but there may be cases with very poor oral hygiene with active periodontal disease. In that case, on your problem list, the notes you make, you have to address this. You have to say, I will evaluate the periodontal status of the patient, or I will refer the patient to a periodontist or a GP before I proceed. They expect you to say that, and they have a lot of weightage for maintaining oral health and periodontal health before proceeding with routine orthodontic treatment. Dental status. If the patient has a carious first molar, or if the patient has a white spot lesion on a molar and a healthy premolar tooth, you cannot just say, I will go for an orthodontic extraction of the healthy premolar tooth. They're going to ask you, why not extract the carious tooth? So always, according to their protocol, which is very different from the Indian approach, like how we look at it, we would be very emotionally attached to the first molar. We'll say, restore the first molar and then extract the premolar, but that is not the case. In their protocol, if a tooth is carious, always prefer extracting that if you need an extraction before you go for extraction of any other tooth. So that is their approach to it. And the last parameter here, other information, regular dental attender. Now you'll get a lot of cases in part A as well as part B, where they'll say the patient is accompanied by a guardian. The mother is not well. The father is traveling. So the patient has come from somewhere else. Do you take consent for the treatment from the guardian or from the patient who's a child or from the mother or the father? This will be the trick question that they ask you. So for all this, there are a lot of laws and guidelines on their website, and that will be the catch. Like they'll give you a big list of information, and then the final will just say whom will you take the consent from. So you have to be very thorough with the guidelines for consent and guidelines for management of a child patient who is accompanied by a guardian or someone else. So this is very important for them. So I would say practice writing down the findings of the case. Make a template like this so that you find it easier to do it later on during the exam as well. Like the template is just a sample, but you don't need to have it printed out like this. Like as you start writing, you should know, okay, this is what I'll write in this, it should just come as a flow to you. Like how you write your case sheets after, like, say, 5 or 10 cases, you know what goes where. It should be like that. You should just have it in your head. And this will make sure you don't miss out on any points. And even the exam, they just give you a blank A4 sheet. So you know where to start writing. That really helps. So frequently asked case types, you can get a growing class 2 patient with functional appliance, a camouflage case where you have to extract. You can get a lot of transpositions or impactions. Personally, I would say out of the 8 diagnostics and mechanics cases that I got for my Part B exam, out of the 8 cases, at least 6 to 7 of them had some type of impaction. It doesn't always happen like that, but they like impaction cases. So you have to make sure you're thorough with all that. Then class 1 crowding, class 2 division 2, growing class 3 hyperdontia, a case with all 6 extractions, balancing and compensating extraction. Like I said, 1/6 has already been lost to caries. Will you extract another 6 to maintain the midline, or will you preserve the 6? Will you proceed with all this? So they pay a lot of attention to these kind of questions. Surgical cases, mixed dentition cases, you'll have to know. So yeah, basically what you have to know is go through all of this, like I just told you, but be prepared with evidence. If you have 2 to 3 plans that could happen, you are always allowed to say the patient is in a class 2 division 2. I want to correct the overjet and then watch. I want to reevaluate the patient before I proceed. You are allowed to say that. Now, when the examiner wants to guide you towards another path, he says, suppose this is the molar relation then, or suppose this is the facial profile then what will be your option? So when they guide you towards a certain path, you need to have your evidence to say, this is what I want to achieve. If this is what it is, this is what I want to achieve. Or they will give you 2 options and say, at that point, will you go for an extraction or a non-extraction? So then you need to have your evidence to say, this is why I want to extract, or this is why I do not want to extract. You're allowed to say, I can wait and watch, but at times they will guide a certain. So in this section, how they score you is less based on your English proficiency. It's not a test of English. They want to know how humane you are, how professional you are, how well you pay attention to the patient, and how easily you are able to communicate. You do not need to use fancy words, or you do not need to have an accent to impress them. You can talk in English how you would normally. They just want to know how easily you are able to communicate to the patient, how polite you are, and how well you listen when a patient talks to you. These are the things that they want to know. So now the communication section, you have 4 cases, and you have to pass each of these cases individually. It does not combine with the previous sections. So this section is independently to be passed. Now, scenarios that they can give you in a communication scenario, an extraction was a non-extraction. A patient is asking you, why do I need teeth to be removed? Or post FA, a patient can come to you and say, I have a sharp wire poking, I don't know what to do. Or a patient who needs surgery but is not convinced, so you will have to give them all the information for them to make their own choice. Someone who's not very compliant, not maintaining oral hygiene. At that time, according to their protocol, initially you give them a few warnings, but then later on you'll be like, I've given you a few warnings, and at this point it's not advised to continue with your fixed appliance, so I'll have to debond because you're not maintaining your oral hygiene. Or retainers. And basically these are very common scenarios that they ask in your communications. So where to prepare from? I'd say basically all the theory that you use for your part A, it's very useful when you go back to your part B exam as well. Make sure you know evidence, Cochrane reviews related to dentistry or related to orthodontics. There are a handful of them. Now, if you know your authors and if you know the final summary of what each author is trying to say, that's very helpful. So know your evidence. For part B, knowing evidence makes all the difference from someone who's just passed and someone who's done really well. And all your basics of biomechanics, and go through the communications booklets and the advice sheets on their website. So references, make sure whatever plan or whatever justification you're giving, back it up with some reference. You can't just be like, no, I will not extract in this case. They will say why, and you can't say like it will not help. No, they need to know that you know your science, that you know your evidence. So always look through the standard textbooks, look through the most recent publications. If you feel that there's something out of here that you want to say, you can always go back to Google Scholar. Google Scholar is your best friend to find new relevant references. So make sure you justify whatever plan you're giving them. Again, you can look through all their advice sheets and all the instructions before you proceed. Keep yourself updated with all the instructions on the website. So thank you. That was the little bit of knowledge that I had and that I could share with you. And I'd like to thank Dr. Anisha. I'd like to thank my college, Savita Dental College, and of course, Royal College of Surgeons of Edinburgh for this opportunity.
So, ma'am, what is the difference between the four exam patterns of the Royal College exam?
So there are different royal colleges, like I told you, and the reason why I picked this one was because as a postgraduate, you can appear for the exam, but you do not need to display any of your treated cases. So I thought that was a very fair treatment. Like we all get whoever it is that's applying for the exam, you all get the same cases, the same amount of time to prepare, and the same set of questions that they will be asking you more or less. So you do not need to show any of your cases if that's something that any of you have been worried about. For the Edinburgh pattern, none of your known cases need to be presented. Whereas for the other, say Glasgow or Ireland patterns, you do need to give a set of your treated cases and show them the difference in the treatment.
So, ma'am, how much time is typically available between the Part A and the Part B exam?
Okay, so the Part A exam is conducted multiple times in a year. As far as I know, in 2025 itself, there was one exam in January, then one in April, and there's another one being conducted now in September. The Part B exam, however, has very limited centers. So the only center for the Part B Edinburgh exam in India is Savita Dental College in Chennai, and it usually happens once a year. It happened in March in 2025, and the next Part B exam is scheduled for February in 2026. So ideally, Part B happens once a year, and Part A is more often scheduled.
So, ma'am, how many attempts can a student give for a Part A, ma'am?
So the written exam, I think, with this Part A and Part B format, this type of format is going to be there only till early 2026. So whoever is writing it now will probably be the last time to attempt the Edinburgh format with this exam. So the number of attempts again might change because the format is changing. So you will have to be updated with the guidelines on the website to know how many times you're allowed, because the format is like going to be under revision very soon. So you'll have to check that on the website.
So, ma'am, what is the fee structure for Part A and Part B? Do we have to pay separately or do we have to pay together? And how do we do it, ma'am?
So you will have to pay for each exam separately. Both exams you will be paying in their currency, and there is a lot of change that comes into it, because like it's subject to change, I should say, because there's a lot of conversion and transaction fee and everything. From earlier during the year when I attempted the Part A exam, the Part A fee in Indian rupees was around 26 to 27,000 then, but right now it's much higher because they do keep updating the fee patterns and there's a lot of transaction charges involved. The Part A exam is cheaper comparatively. The Part B exam, because it's a 4-day exam and because There's a lot more process involved with it. The Part B exam is slightly more expensive, but I would say overall, if you have the MOrth degree, the cost of it is actually worth it. It's something you should keep in mind, but definitely I would say it is worth it. So yeah, you should check the current cost of both the exams on their website.
Ma'am, previously you mentioned that there will be some changes in the exam pattern from the next year. Do you have any idea what those changes might be?
So the information that we have received from the BOS website right now and the Royal Colleges right now says that the exams that have already been scheduled and put on their website, that is the September 2nd Part A exam and the February Part B exam, those are the exams that still follow the MOrth A and B pattern. After this, later on in 2026, they're going to shift to a pattern where you need to write an MFDS exam. So, an MFDS exam, the preparation will be similar, but the number of exams or the number of attempts that you have, they might have slight variations. And that's why I'd say if you find an exam that's scheduled and they put it up on the website, this is the easier pattern that we are familiar with. So, better to take up this offer while we have it, while we know what we are going for. MFDS might be a little bit more challenging, but again, we do not know the regulations of that exam properly yet.
How did you structure your timeline for preparation, ma'am, considering the demands of PG life? Like you have to manage clinics, seminars, journal club presentations, and also thesis. So, did you follow any specific daily or weekly study schedule? And how did you manage to strike a balance between the clinical work and the focused preparation?
So I should say the part A, the written exam required more of planning and studying theory, whereas the part B exam is good if you have more clinical work and more clinical exposure. It's just like part of your practice for the part B exam. More effort goes into A, and I'll tell you why. Because there's a lot of theory and there's a lot of their guidelines that you need to know. Once you're thorough with their guidelines, that for the part B, you just have to revise what you know already, practice with cases, and maybe just brush up on evidences to substantiate for part B. So for the A exam, what I did was, like I said, I picked one book, The Handbook of Orthodontics by Martin Cobon. I made sure I read it, all the chapters cover to cover, including all the photos and the graphs and the legends. And once I knew that for sure, I added with the other textbooks. And you will have to make some sacrifices. I'm not going to say it'll be easy doing a full-time PG course and then other seminars and other things, and managing everything else along with this preparation is going to be demanding. But it's barely a few weeks. It's few weeks, and if you're able to manage it for that short amount of time, I'm sure the reward is worth it. So I used to work on my PG related work till about 7 or 8 p.m. And after 7 or 8 p.m., I used to take an hour's break. And I used to sit and prepare for a moth party from say 9 in the night to say 12 or 1. And it was hectic, but I knew it was only for few days, like a few weeks. So I was like, okay, maybe I'll be able to get through this. Once you're done with part A, the part for part B, the preparation of it is much simpler. You don't have to stay up late hours, I would say. You just have to brush through what you know already and just practice with case photos and case records and just brush up with evidences. That's just like a discussion, like a talking session one on one with maybe your parallel or with your senior. So it gets easier. Initially, it's a little difficult, but it gets easier. That's all I would say.
So, ma'am, did you attempt any mock exams or join a formal preparatory courses? And do you have any recommendation to other aspirants?
So there are several mock exams and mock questions that are available on these Telegram groups. There are Telegram groups that are both free and open to everyone, and paid groups that are closed. The thing with any of these groups, whether they're conducted by legitimate course trainers or by just students, are the answers to all of these questions keep getting updated. So there is no at a written exam. They're very secretive about their study material and the questions and the past questions that they have. What they do is immediately after the exam is done, all those students who have attempted the exam, they try to mentally collect whatever questions or whatever type of questions have come up, and they quickly make note of it. And that's how these students form a question bank. It's no official bank that is given by the Royal College. So these are the questions that are gathered and piled up into these Telegram groups. You can refer to them. I would say there is no one that I particularly want to advertise or want to say this one is good or better than the other. But whichever group you pick, I would say make sure you check the answers for yourself. Like someone might say the answer is A, but the credibility of those answers, again, you should take in your personal judgment. Use them as a reference, but do not use them and say, this is the answer, so that is what I will write in my exam. Make sure you use your own judgment. Go back to the textbooks, make sure you're sure of what they're saying before you follow it.
Ma'am, many PGs are a bit unsure whether to take MOrth exam during their course. So, what would you say to help them make an informed decision, ma'am?
I will actually say I was one of those PGs because I thought, do I really need to do this during my final year? I have enough work and enough stress as it is. But looking back now, my final year exams are scheduled in a few months, and I will say maybe I'm a little bit more confident with the preparation, and maybe I'm a little bit more confident with the clinical perspective and how I approach references or how I approach the recent evidence when I want to give a treatment plan. It definitely gives me a sense of confidence knowing that okay, I am a little capable of giving something that the examiners will agree with. You know, it gives you that boost of confidence for sure. And whatever preparation that you push into the last few months of your PG life for your PG exam, it's the same preparation, it's the same orthodontics, it's just something you are reading maybe a few months in advance. So it's like one thing out of the way. Well, if you're done studying say 4 or 5 months ahead itself, then all you have to do is just brush it up, and you know you feel way more confident when you have to attempt your PG exam. And again, if you have that degree in your hand before your MDS, I should say it gives you a little bit more confidence to to attempt anything else, you know, to face your exams. You can say for confidence, you know, I've already tried, and yeah, that gives you all that you need.
So, ma'am, finally, how do you think clearing a MOrtho exam will influence your future, both academically and professionally?
So it is, I think, first off, before anything else, if you have an additional degree that is set up by an international college, one of the oldest surgical colleges in the world, that itself gives you a sense of satisfaction. That itself gives you some confidence. Like, okay, I've learned something, I know something, I'm capable of getting a degree. That is the first advantage, I would say. Second, it is an internationally recognized college. Not many countries would recognize your MDS and allow you to practice as an orthodontist. But if you have an MOrth from a royal college, there are several countries in UK as well as outside. There are several countries that recognize this degree, and you can use it to your advantage academically. And even if you want to pursue further studies, want to say set up your own clinic, for all of those reasons, this is one step higher than a normal MDS degree. But I should say, whichever country you decide to practice in after you get your MOth, you still need to individually clear their that country's licensing exam. Once you clear that country's licensing exam, you are allowed to practice there as an orthodontist